Hello, this is Dr. Marcelo Kugelmas. On behalf of the Chronic Liver Disease Foundation, I'd like to thank Madrigal Pharmaceuticals for their support in bringing you this educational content.
Well, welcome. I'm Dr. Kimberly Brown. I am the Associate Medical Director for Liver Transplantation at Henry Ford Hospital. So one of the newest medications that we have, in fact, the only medication we have currently approved for the treatment of MASH is Resmetirom. As you may know, this is a thyroid hormone beta receptor agonist that really acts within the liver to decrease lipid contents, particularly triglycerides within the liver. And it's likely in part through that action that it has its effect both in terms of NASH resolution as well as in fibrosis regression. When we look at the clinical data, we know that not all patients will respond, obviously, but in the clinical trial data that was submitted to the FDA, there was significantly higher percentage of patients who had NASH resolution as well as fibrosis regression as compared to patients who were receiving placebo. One of the questions that I frequently get asked is that there's note that the placebo patient population also in part had fibrosis regression. If you look at the 100 milligram dose, the fibrosis regression was about 25% in the patients receiving Resmetirom versus 14% in the placebo arm. But we recognize that the placebo rate in all of these clinical trials is not zero. We also recognize that as patients come into clinical care, even if they're receiving placebo, their general health improves. They get more attention. They have to adhere to treatment protocols, and we see placebo rates actually across all of the clinical trials with respect to the trials currently being done for MASH. But when we look at the overall data for Resmetirom, significantly higher percentage of people achieve those endpoints when receiving Resmetirom as compared to placebo. One of the questions that I am often asked, it has to do with its action on thyroid hormone receptors. We recognize that a beta receptor of THR resides primarily in the liver, and that is where the mechanism of action occurs. Most of the extrahepatic, cardiac, and bone THR receptors are alpha, so much less activity outside of the liver. In fact, there were patients who were on Resmetirom who were taking thyroid medications, and as long as the patient has controlled thyroid disease, there's no contraindication to taking the medication. Side effect profile was good. It was found to be safe. There was an indication of slightly higher rates of nausea and diarrhea in the patient population receiving Resmetirom. But again, letting your patients understand what the side effect profile is and what to expect, and also helping them to understand that patients over a few weeks on medication appeared to become tolerant and side effects lessened. So well-tolerated medication, certainly not the answer for all of our patients, but clearly the best tool that we have in our toolbox currently to treat our patient population with MASH. One other thing that I would mention too is who we should be using this medication in. Clearly, it is the patient population with moderate to advanced fibrosis, F2 or F3. Patients with cirrhosis were excluded from the clinical trial, but there is ongoing investigation in the patient population with cirrhosis, but currently not indicated for the patient population with cirrhosis. Furthermore, the trial is ongoing. One would anticipate that both resolution of MASH or NASH and also fibrosis regression would continue to improve over longer periods of studies. So the original clinical trial was at 52 weeks, but ongoing clinical data analysis in patients undergoing therapy, that is ongoing, and we hope to see results of that in the future. So I will thank you for your attention. And if you have further questions, please feel free to join the GAP website for information both on Resmetirom, but on other liver-related topics as well. Thank you.